Hello everyone, welcome back to Homeo Vision. This is Dr. Kiran. I will be dealing with the AIAPGT 2021 repertory previous year question today. Okay, so as I already dealt with the AIAPGT 2022 as well as 2023 questions. Okay, so you might have got an idea regarding the question on which the repertory questions will be based, right? So before I move on to the actual topic, I'll be dealing with what are the high yield areas or the high yield question that can be probably asked in the repertory in the repertory AIPGT 2024. Okay, so as 16 questions has been allotted for repertory subject. Okay, so the areas which are very important or you need to know with respect to AIPGT 2024 is construction of the repertory, arrangement of chapters, gradations, number of remedies, year of publication, rubric hunting, mind rubrics, as well as the single drug rubrics. So these are the areas of interest of the examiners, so in which they frame questions accordingly. At least the construction, arrangement, chapters, number of remedies, year of publication, rubric hunting, mind rubrics, single drug rubric, all these aspects or all these topics should be very thorough with respect to Kent repertory, BTPB as well as BBCR repertory. Okay, so moving on to first question, the rubric for cracking of joints is given in which section of BTPB? Okay, so whenever you read the question, so always be very thorough with what repertory they are asking the question on. Okay, so the question is they have given they have mentioned the rubric, we need to identify the chapter. Okay, so aggravation is quite ruled out because it's a general aggravation, and cracking of joints is nowhere related to the aggravation. And then the only probability you can suspect is extremities or sensation. Okay, so in extremities chapter more with respect to particular specific joints is given, and in general it is not given. Okay, so the right answer is, if you see the Boningosson therapeutic pocket book, under sensation chapter you have cracking of joints rubric. Okay, so the right option is sensations. Moving on to next question, the year of publication of synthetic repertory is 1973, 1987, 1993, 1996. So this is a question based on a modern repertory, so which is synthetic repertory. Okay, so always read the question twice. I've been repeatedly telling this again and again. The reason why is because one simple mistake may lead to great disaster, and you may lose a seat in a government or a central government institute. So synthetic repertory is a modern repertory. Okay, this is not synthesis, it is synthetic repertory, and we need to know in which year the synthetic repertory is published. Okay, under that there are four options. I'll be dealing with all the four options in which particular year which particular repertory is published. I'll be dealing with it. So here this is the synthetic repertory where it has 3 volumes. Okay, so it is written by Barthel and Clunker. So the first volume is written by Barthel. Okay, so under these 3 volumes repertory, okay, though it is based on a Kentian repertory, it was published in 1973. So after the Kent's repertory, whatever repertories has been published, it is called as post-Kentian repertory, and these are the repertories which are post-Kentian as well as the modern repertory. So in 1973 synthetic repertory is published, whereas synthesis, so synthesis it's the 5th edition. Okay, so 5th version is published in 1993, whereas synthesis as well as the homeopathic medical repertory. So the picture I have given is the 3rd revised edition, but the first homeopathic medical repertory, the first edition was published in 1993. Synthesis as well as homeopathic medical repertory by Robin Murphy, or what we call it as Murphy's repertory, is published in 1993. Okay, so and then the complete repertory is published in 1996. Okay, so the right answer is 1973. So since it is synthetic repertory, the right answer is 1973. Okay, moving on to next question, the medicine given in Kent's repertory for hair fall during pregnancies. So this is a little tricky question, because what happens, majority of the aspirants, they try to answer this question based on their previous knowledge or the remedial mathematical knowledge. Say for example, so we know hair fall, there are many remedies. We have phosphorus, fluoric acid, natramure, sulfur, lycopodium. Okay, so but we are not very much aware of the lachesis. Okay, so that is why even if you see, it's a more twist question, because we have many twisty option, and then you may end up in answering the wrong option unless and until you have not went through the repertory thoroughly. Okay, so if you answer this question, there are chances you might get this answer wrong. Okay, so the only remedy in the Kent's repertory under head hair falling pregnancy during. Okay, so pregnancy during is the sub rubric here. So in the under that you have only single remedy is lechesis. Okay, so the option A, lechesis, is the right answer. Moving on to next question, the symbol mathematical pi in Knerr's repertory indicate. Okay, so Knerr's repertory, as you know, there are two Puritan repertory where the symptoms or the rubrics of the patient as it is mentioned in the repertory. Okay, so Knerr's repertory is again based on Herring's guiding symptom. The entire 10 volumes of Herring guiding symptom has been compressed into one single volume, and then it has been published by Knerr in 1896. Okay, so under that there are many, after some remedies, there are some signs mentioned. Say for example, cross reference is mentioned with hand sign, and T is mentioned for toxicological extract. Okay, so whereas pi symbol is mentioned for symptoms observed in sick only. Okay, so these are the symptoms whenever you find a sign pi in the Knerr's repertory. Okay, so under the symptoms observed in sick only, so that means these are the symptoms which are only observed in the sick. Okay, so you have to remember it is the pi. And then moving on to next question, so this is a statement based question. Okay, so as I already dealt in the previous video as well, there will be two statements. Okay, so in which you need to know the entire statement correctly, and you should associate with statement 1 whether you should tell it is true or is it false. Okay, the foundation of Boninghosen therapeutic pocketbook is doctrine of concomitant. It is that which gives the book its peculiar value. Okay, and a separate section of concomitant is given in all chapters of therapeutic pocketbook. In the light of the above statements, choose the correct answer from the option given below. So you need to say whether it is both are false or both are true, which one is true or which one is false. Okay, so the question is quite clear because I already dealt in the previous videos many statement 1 and statement 2 based question. Okay, let's see the statement 1. The foundation of Boninghosen therapeutic pocketbook is doctrine of concomitant. This is the peculiar value of the book. Okay, so as you know, this is BTPB. Okay, so Boninghosen was the first person who told about concomitants. Okay, so he didn't actually mention the word concomitants, but he told the unreasonable attendance. So it is nothing but the keynote symptom. Whenever in a complete symptom, concomitant is nothing but whenever the particular symptom is not related to that exact symptom. Say for example, we have many concomitant symptom mentioned in BTPB. Okay, so definitely it is and even in the 4 fundamentals, LSMC, location, sensation, concomitant, and modalities, you have concomitants which is mentioned in a very peculiar manner, and this is the uniqueness of the BTPB as well. And Boninghosen, though he was the father of repertory, and he was the first person who coined the term unreasonable attendance. Okay, so which is nothing but concomitant. So the statement 1 is true. And if you see the concomitant, second statement is they mentioned that concomitance is mentioned in the BTPB. In the end of every chapter, concomitance is mentioned. Okay, so this is the question. A separate section of concomitants is given in all chapters of therapeutic pocketbook. So let's see whether it is mentioned in all the chapters of therapeutic pocketbook. End of all the chapters, whether concomitants is mentioned or not. So in the BTPB, it is not mentioned. Okay, so whereas in the BBCR, concomitant chapter is mentioned in majority, concomitant section is mentioned in end of the majority of the chapters. So if you see BBCR, there is a particular pattern. Say for example, after some, say for example, head chapter, so there is time modalities, aggravation, amelioration, and then ultimately the concomitants is also mentioned. Okay, so this is what this one is mentioned. So whereas in BTPB it is not mentioned. So the statement 2 is false, statement 1 is true. Moving on to sixth question, the rubric for presbyopia is available in repertory and chapters as. So there are 5 main headings. Under that you need to select in which repertory and in which chapter the presbyopia is mentioned. Okay, so if you see Kent vision, Kent eye and vision, therapeutic pocketbook vision, BBCR head, BBCR eye. Okay, so you need to know in which you need to know. So for this particular rubric you need to know all the three repertories. So for example Kent, BBCR and BTPB. Okay, so in which chapter the presbyopia direct rubric is mentioned. Okay, so here in the option you have A, C and D only, and then you have B only, D only and E only. So this is a multiple repertory question where you need to have knowledge of all the three repertories. But it's a quite simple question because so if you know presbyopia, again it's a age related accommodative disorder where you have a gradual loss of ability of the eye to focus on the nearby object. Okay, so this is what the image is showing, and this is what the patient present also. So in the BBCR you have the direct rubric under eye vision presbyopia. Okay, whereas it is not present in any of the repertories like Kent and BTPB. So the right option is E only. So this is the only rubric. Presbyopia is only mentioned in BBCR. Eye, under eye there is vision, under that there is presbyopia. Okay, so moving on to next question, match list 1 and list 2. Okay, so there are two lists mentioned here, so always read the question again and again. Be very thorough with what they are asking, and be very thorough with what options you mark. Even after marking the option, you make sure you're no you're you re-verify once again. Okay, because in this question list 1 is nothing but the repertories. List 2 you need to match the author of the repertory. Okay, so if you see here, in the out of 4 questions, all two are equally confusing. Say for example there is Kent's final general repertory and Kent's repertorium general. Okay, so you if you know only Kent repertory, then this is not the question for you, so you might need to quit. But I always tell match the following options will be always suggestive, and if you are able to rule out the questions, then again it will fetch you good number of marks, and it will help you in getting good ranks as well. So and then the other two repertories are synthetic and synthesis repertory. Okay, so here Kent's final general repertory. Okay, so as I will only solve with option B and C first, that is synthetic repertory and synthesis repertory. Synthetic repertory, in the beginning of the video I already told the author is Barthel and Clunker. Synthesis repertory, it is nothing but your app version, and you also see it in radar. Okay, so it is published by, it is written by Frederick Stroyens. So option B is 2. Okay, so and option C is 3. So B2 and C3. So if you it's quite easy to rule out now, so because only remaining option is option A and option D, because B2 and C3 is common in option A and option D. Okay, so then Kent's final general repertory and Kent's repertorium general. Okay, so Kent's final general repertory is the very revised edition of Kent's repertory, now where the manuscripts were stolen, and you might have heard in your UG repertory classes. So Perry Smith and Diwan Harishchan from the India, they tried to collect the manuscript and they published the repertory. This is nothing but the Kent's final general repertory. So the option A stands for list, in the list 1 option A stands for list 2 option 4. Okay, so then Kent, obviously Kent's repertorium general is published by Kunsley. Okay, so the correct answer is option D. Okay, so A4, B2, C3 and D1 is the option. Then how will you arrange the rubric representation in Kent's repertory for a person presenting with left-sided sciatica? So as you know, it's a here the question is based on Kent's repertory, and you need to arrange the exact rubric which is mentioned in Kent repertory. Okay, so and if you see the options there, so sub options like main pain extremities, sciatica, left lower limbs. So it's very clearly mentioned that. Okay, so it's a chapter wise, the chapter is in extremity. Okay, so if you see Kent repertory, so this is the sciatic nerve, which starts from the lumbar and sciatic nerve roots and the sacral nerve roots, and again it end up to pain in the posterior aspect of the thigh extending to the toe. Okay, so here the right rubric is extremities, right arrangement is extremities pain, lower limb, sciatica, and they also mentioned the side. Okay, so as you know, the in Kent's repertory STME pattern, so first is the side, under side they are given left. So extremities pain, lower limb, sciatica, left is the right answer. So the right answer is B, A, E, C, D. That means extremities. Even though you know the answer, this option marking should be very perfect so that no will not jumble with the options given here. So the right answer is option 1. Moving on to next question. Question number 9. So here again it's a question based on rubric hunting, where they have given the symptom or the rubric in which chapter it is mentioned you need to tell. So it's a question based on Kent's repertory. Abducted lies with limbs is mentioned in which chapter? Okay, so this is a quite easy question. The only thing you'll get confused is because so lies with the limbs is given, so you either confuse it with the sleep chapter or it is with the extremities chapter. Okay, so if you see lying, of course there are many sleep position given in sleep chapter, but here the right answer is extremities. Okay, so under extremities you have abducted lies with limbs. So and this is the first rubric in extremities chapter of Kent's repertory. Moving on to next question. Awkwardness is mentioned in which chapter of Kent's repertory? Okay, so what is awkwardness? Okay, so it might be a mind symptom in many of the other repertories, but here the awkwardness is mentioned in the extremities chapter. That means extremities awkwardness, it's a very vague position of the extremities. Okay, so that is why it's mentioned awkwardness in Kent's repertory is mentioned in option B, extremities. Okay, then moving on to next question. Pain in abdomen. Again, this is a question based on Kent's repertory. So in AIAPGT 2021, there were 3 rubric hunting question from the Kent's repertory itself. Okay, so and that too in different section of Kent's repertory. So because majority of the time we focus on the mind section of Kent's repertory, but here they have given in different sections of Kent's repertory. Say for example, I told previous extremities, then the abdomen. Okay, so there are different areas where you need to mention and you need to be knowing also. So pain in abdomen, menses appear as if. Okay, so since the menses is given, majority of the students have attempted it wrong. They have mentioned it either female genitalia or genitalia. Okay, and sometimes it can be generalities as well, but the right option is, so pain in abdomen, menses appear as if. Okay, so this is quite similar to dysmenorrhea. So whereas in Kent repertory, the rubric for dysmenorrhea is mentioned in female genitalia, menses. Under rubric menses there is painful. Female genitalia, menses painful is the rubric for dysmenorrhea, whereas pain in abdomen, menses appear as if is mentioned in the abdomen chapter. Okay, option A, abdomen is the right answer. Then sucking the thumb is mentioned in which chapter of BBCR repertory? So this is again a rubric hunting question from the BBCR repertory. So in the previous video I have dealt with the AIAPGT 2022 repertory previous year question. In that there was the same question mentioned in a match the following form. Okay, so sucking of the thumb, especially it's a, as I told in the previous video, so it's a rubric based on children. Okay, sucking of the thumb in children is mentioned in upper extremities chapter. Okay, you have constitutions like calcarea foss, you have Silesia child. Okay, so the right answer is option D, upper extremity. Then moving on to next question. Abortion is mentioned in which chapter of Boningosan therapeutic pocketbook? And because you can't remember all the rubrics and all the chapters of all the repertories, so you need to know, you need to be little smart. Okay, as I've already mentioned it again and again, that there are questions where they keep asking, there is a tendency to ask questions from the misplaced rubrics of Boningosan therapeutic pocketbook, and the abortion rubric is mentioned in misplaced rubric. Okay, so some of the misplaced rubric which is mentioned in Shashikant Tiwari, you should be knowing it completely. Okay, so the right answer is menstruation. Okay, so you can see here there are many other misplaced rubrics as well, where you have anus, hemorrhoids, rectum, perineum. Misplacedly it's mentioned in the stools chapter. They also have abortion mentioned in menstruation chapter, vertigo in mind and intellect chapter. Okay, all the misplaced rubrics should be known at the tip of the tongue, so that immediately when you see a question based on BTPB, majority of the time you always try to rule out whether this is a right rubric or it is a misplaced rubric. So the right answer is option B, menstruation. Then match list 1 and list 2. Okay, so here the list 1 is the list of rubrics from the BBCR and list 2 is the chapters from the BBCR. So we need to match the rubric with the exact chapter. Okay, so let's see what is the easiest rubric in the list A first, and then we try to match it. Okay, so sinusitis, as you know, it's quite often associated with rhinosinusitis. So option under list A matches with the option 2 of nose. Okay, so option A, so A is 2. Okay, so if A is sinusitis is the right rubric mentioned in the chapter nose, then the A is 2. That means option D is ruled out, because in the option D they have mentioned A3. So you need to rule out between the other three things. Okay, and hemophilia, in the previous video I have dealt that no, hemophilia is mentioned in sensation and complaints in general, because it's a pathological general where there is a bleeding tendency in joints, in anal openings. In normal, it's kind of scurvy symptoms are mentioned where there is gum bleeding. Hemarthrosis are mentioned in hemophilia. So hemophilia is seen in sensation and complaints in general chapter. So A is 2, C is 4. Okay, C is for again. Now you have ended up in two narrow option, that is option A and option B, where A is 2 and C is 4. Okay, so and then now the main confusion is between emotions and nervous exhaustion. So how do you relate now? Because majority of the mind chapters of Kent's repertory, many emotions are mentioned. You might have studied in UG as well. Whereas nervous exhaustion can be given in aggravation and amelioration chapter. Okay, if you are having guesswork, it will lead to a wrong answer here, because in the conditions of aggravation and amelioration in general, it is not just the physical symptom. Okay, there are many mind rubrics also mentioned which causes aggravation in general as a person. Okay, many mind rubrics like emotion, anger, okay, so and then jealousy, all these kind of rubrics are mentioned in aggravation and amelioration in general. Okay, so the option B under list A is again option 3 in under list B. Okay, so the answer is B3. Okay, so next, of course, the last remaining is nothing but nervous exhaustion is again mind. So the right option is option B. Okay, so option B is the right option. So here there is one more question based on list 1 and list 2 of the Kent's repertory. Okay, so here in the Kent's repertory, it's not just in general Kent repertory, but the list of repertories are mentioned, and under list 1 there are list of rubrics. Okay, so you need to match the right rubric to the right repertory. Okay, so here at least you should be able to know, because it's a little quite tough question. Unless and until you are not seeing repertories in and out, not consulting repertories in and out, so this will be a very difficult question to answer. So under list 1, so at least I could remember that pyromania is nothing but setting fire. Again, it's you have a single remedy rubric HEPAR there in BBCR repertory. So B, I could trace it as 3. Okay, so B, I could trace it as 3. So if you see under which option the B is mentioned as 3, there is option 3. Okay, so the right option is option 3 here. So see, because whenever the question is very difficult, so the option of choosing the right answer will also become less, and probably majority of the students who have left this question might have also gained a mark. Like, even if you don't get a positive response, if you are preventing yourself from getting a negative mark, that again itself is a bonus in AIAPGET 2024. So pyromania is given in BBCR, and then aggravation from wrong position is given in BTPB of aggravation chapter. Molluscum is given in boric repertory, and aura epileptica is mentioned in Kent repertory. So the right option is option 3. Okay, so A2, B3, C4 and D1. Okay, moving on to 16th question. Given below are two statements. One is labeled as assertion A and other one is labeled as R, which is mentioned as reasoning. Okay, so this is a question based on assertion and reasoning. That means, see, in the previous question I have dealt with statement 1 and 2. So there you need to mention whether the statement is true or false. Okay, if you are very clear with that ideology, it's very easy to answer either it is true or false. But here in the assertion reason, So you have to know whether the assertion and reasoning is right or wrong. Along with that, is there any association between assertion A and assertion R? Reason R is also mentioned in this particular question. Okay, so for example, all medicine under chapter extremities, heaviness, lower limbs, exertion after in Kent's repertory are mentioned in first grade. Reason are rubric pain is not present in stool chapter of Kent's repertory. Okay, so first thing is whether we should know which one is right and which one is false. First, let's see the assertion part, where because this is a question which is mentioned in AIPGT 2022 as well. Okay, this question I have already dealt in the previous video. If you can see this is again a repeated question. The reason why I am doing previous year question is because majority of the question may arise from the previous year question. Okay, and this is the only blueprint you have for appearing for AIPGT as well. And then if you see here, so under extremities, heaviness, lower limbs, exertion after, you have 5 remedies: conium, gelsemium, lachesis, picric acid, rustox, all are mentioned in first grade. So that means assertion is true. Okay, assertion is nothing but statement 1, it is true. And if you see reason, rubric pain is not present in stool chapter of Kent's repertory. Okay, so where do you expect pain in no, usually pain in anorectal area? In which chapter do you expect? Obviously you expect in rectum pain. Okay, even rectum hemorrhoids painful, direct rubrics are there, but in the stool chapter rubric pain is not mentioned. In the stool chapter only the character, color, consistency of the stool is mentioned, the shape of the stool is mentioned, whereas the pain is not mentioned. So that means assertion is true and reason is false. Okay, no, the rubric pain is not present in the stool chapter, even the reason is right, but there is no relation between assertion as well as the reason. So that means both A and R are true. Okay, and R is not the correct explanation for A, so correct answer is option D. Okay, so you should always have the tendency to get confused in this kind of question. Okay, so as I told, assertion and reasoning questions, you should always relate whether the first statement has any relation with the reason statement as well. Okay, so that is the most important thing, and majority of the time, even if you don't know the right answer, okay, so then it again becomes difficult to analyze correctly the rubric as well as the assertion and reasoning things, and that will again end up in losing marks. Okay, even if you are aware of that question, you may have the tendency to lose mark in this particular question. Okay, moving on to next question, loss of appetite belongs to which class of symptom? Okay, so here this is the last question. No, this is the last but one question. Okay, so here this can be also a question of organ of medicine, but because this is a symptom classification question and each and every symptom is helpful for the selection of the rubric, I have mentioned here as 4 option. Okay, so here Bonning-Osson's complete symptom. So what are complete symptom? Okay, Bonning-Osson complete symptom, as you know, it is location, sensation, modality and concomitant. Okay, loss of appetite will not hold good with respect to complete symptom, because location is not given, sensation and modality is also not given, so that is ruled out. And Garth-Boric determinative symptom. So for this you should know the Garth-Boric classification of symptom. Garth-Boric has classified classified symptoms into 2 symptom. One is basic symptom and next one is the determinative symptom. So determinative symptom is uncommon symptom and basic symptom is the common symptom. So loss of appetite, since it is more of a common symptom, it's not mentioned as a determinative symptom, so option B is ruled out. Option 3, Hahnemann's general symptom. Okay, so you should be remembering this particular symptom as very important symptom, because Hahnemann general symptom are the common symptoms. Okay, whereas Kent's general symptom are physical and mental general symptom. Okay, so I repeat once again, Hahnemann's general symptom are common symptom and Kent's physical general and mental general are the general symptom. Okay, so Kent classified general symptom in 2 different ways, mental as well as physical, whereas for Hahnemann general symptom is a common symptom. So option C is the right answer. That means loss of appetite belongs to Hahnemann's general symptom. Kent's particular symptom, as you already know, it's the part of the body which is affected. So for example, extremities pain or head pain. So this is the particular symptom. And under Kent's classification, it is characteristic particular. So since it's just mentioned as a particular symptom, loss of appetite has no role to play with particular symptom. So option D is ruled out. The right answer is Hahnemann's general symptom. Okay. Moving on to last question. So this is a very basic UG question where you might have learnt about repertory in the fourth year of your BHMS. So this is a question where Bonninghausen's concept of cubis auxilis signifies the options. Okay, what does it simply means? What does cubis auxilis means in the below symptom? Okay, so whether the answer is causes of the symptom, concomitant symptom, whether it is modalities or the seat of the disease. Okay, as you already know, the Bonninghausen's hexameter. Okay, quis quid ubi cubis auxilis cure comedo and quando. Okay, they have mentioned about the cubis auxilis, that is nothing but the concomitant symptom. So the right option is option B, concomitant symptom. Okay, so these were the questions of repertory AIPGT 2021. Okay, so here in 2021 there were majority of the question. Okay, so it's for example in this year they have mentioned nearly 17 to 18 questions from the repertory, but since there is already a very fixed blueprint for AIPGT 2024, 16 questions are mentioned under repertory section. Okay, so repertory subject is a very important subject, especially for people appearing for AIPGT, because it's little tricky, but it's quite easy to score marks as well, because out of 480 you can score 64 marks completely. Okay, so even even you can score the complete, like all the 16 questions you can score complete marks, not even no letting go of a easy question, or say for example even the tricky question you are able to answer it rightly, you can fit 64 marks completely in the repertory section. So I always tell always study previous year questions first, and then you go on to the try to brush up the other basics of repertory. Say for example evolution of repertory, year of publication, and then the gradation of different repertories. And whenever it comes to mind rubric hunting, so as I mentioned in the first slide of this presentation, it's quite clear that they are always asking from rubric hunting from the basic repertory like BTPB, BBCR, Kent repertory. So be thorough with Kent's repertory, be thorough with BBCR and BTPB repertory. Different chapters, always compare and study. It will again help you to fit seat in a central government institute like NIH Delhi and NIH Calcutta as well. So and all the best for your APGT exam. Thank you.